because one of the things about psoriatics is we have a personality type where the way I describe it is we turn our hobbies into obligations. And so we tend to be hyper stressed out people. And acupuncture, minimally, even if it's needles in the wrong place, will calm down the nervous system and allow for psoriatics to like not get so overwhelmed.
Welcome to the Inspired Living with Autoimmunity podcast, the podcast for high achievers who want to stay sharp, focused, and full of energy despite their diagnosis. With your host, National Board Certified Functional Medicine Health Coach, Julie Michelson, where Julie helps you take your power back from autoimmunity. And now here's your host, Julie Michelson.
Welcome back to the Inspired Living with Autoimmunity podcast. I'm your host, Julie Michelson. And today we are joined by Dr. Sydney Malawer, who runs the Tendervine Health, an acupuncture and integrative East Asian medicine practice in Berkeley, California, specializing in the treatment of complex conditions, in particular autoimmunity and dermatology. Dr. Sydney's training is focused in traditional Japanese acupuncture and moxibustion, classical herbalism, and clinical integrative East Asian medicine. In today's conversation, we are demystifying autoimmunity from the Chinese medicine perspective, and Dr. Sydney explains how approaches like moxibustion can be autoimmune game changers. Sydney, welcome to the podcast.
Thanks, Julie. It's great to be here.
I am so excited for our conversation today, and I would love to start by having you share some of your own journey with listeners, because I know you have a story that's going to make people lean in.
So I have autoimmunity. I've had it since I was 7. So I have psoriasis is the first. So if a lot of people know, autoimmunity tends to come in 3s. So my first one was psoriasis, which I had when I was 7, which is very rare for psoriasis because usually psoriasis happens after puberty, not before. So that means it's a very hard to treat psoriasis. And so I just remember itching my whole life, and I grew up with that, and I went to doctors and they gave me steroid creams. And then I was in college, and it got really bad. So my junior year of college, it was on 75% of my body. And I went to school in upstate New York where it's bitter cold, and my psoriasis is always worse in the winter. And then I was just at my wit's end, and I went to the doctor, and they're like, well, it's the only option for you is a biologic, which I was 20. And they effectively were like, yeah, one of the big risks is leukemia lymphoma, because it cuts off the inflammation process, which includes tumor necrosis factor, which is what actually kills tumors. So I was at my wit's end. I'm 20 years old. And I respect people who want to go down that route. Just for me, I needed other options. I was like, this can't be the only option. And so my dad had suggested I actually go see a naturopath. And I was like, okay, I didn't know what it was, right? I'm from New York. We didn't know what naturopaths were. So I went to a naturopath, and within that conversation, they're like, I think it has something to do with your gut, like what you're eating. So let's do an elimination, and then check back in 3 weeks. So she gave me a really great protocol for an elimination where we took out the 7 major allergens, and then a plan for reintroducing them. And in the 3 weeks I was off, my psoriasis reduced by 50%.
Wow, I'd love to pretend I'm surprised.
Yeah.
But
it was mind-blowing for me because
sure.
I was in this conversation with the naturopath initially. She was like, she asked about my digestion, which my dermatologist had never asked about my digestion. And I had awful digestion my whole life. I remember I always had tummy aches. But I was at the point where I was my junior year of school, a lot of pressure. And I remember it felt like I was passing gravel in my intestines.
Oh.
And I just thought, I'm Jewish. Jews tend to have poor digestion,
We're
right?
A little
so I was
sensitive.
We're a little sensitive. So I was like, I have Jewish tummy. This is no big deal. This is just what I was just
I'm
doled out with.
diagnosing you with Jewish tummy. That is
pretty
awesome.
much.
But also kind of the story I had in my head my whole life.
Yeah.
So,
I was
yeah.
just like, I have Jewish tummy, right? And it's funny because as I learned further on, Ashkenazi Jews have a 4 times more likelihood for inflammatory bowel disease than anyone else. So so Jewish tummy is real, but
Right. But it's,
um,
yeah.
but it was a thing. So I was like, and I had never put the two and two together with the deterioration of my skin and the deterioration of my digestion. And so in those 3 weeks, I felt great. I had more energy. I didn't feel like I was passing gravel. And then when I started reintroductions, when I reintroduced gluten, particularly wheat. She didn't say gluten at the time because this was '08,
Right.
where gluten wasn't exactly a thing. But when I reintroduced wheat, I got all that back again, and my psoriasis started getting bad again. So I took it out, and I've been gluten-free ever since.
Yep.
And it's so funny because people ask if I miss it, and I'm like, no, because I know how painful it was when I was on it.
Yeah.
But it was miraculous. So in in those 3 weeks, it went down by 50%, and then my digestion got better, and then over time, it went away. And since 2008, so that was how many years ago? 16
Mm-hmm.
years ago. I've had 3 major flares when before I was consistently flared since I was 8 years old. And the 3 flares coincided with major emotional events in my life.
Mm.
And
Yep.
so that started really getting my wheels turning, where I was like, oh, the system is more like skin ailments are not just skin deep.
Right.
Right. And I started like really going for more alternative methods because Western medicine, in my case, did not meet my needs.
Right.
Right. And so I started going down this path for my own health. Right. I worked in something completely different for 10 years. I worked in social enterprise.
Okay.
So I helped build socially minded startups for 10 years. And then I remember I was 29 and I was like, oh my God, I'm turning 30 next year. What do I actually want to be when
What
I
do I
grow up?
want? Who do I want to be? Yeah.
No, legit. I was like, oh, because my entire 20s was doing things that people told me I'd be good at.
Right.
So that's why I worked in social startups. I was really, really good in like understanding and reading people. I'm really good at like responding on the fly and like building things from scratch. And so that's why I did that, because people told me I'd be good at it. And then when I was turning 29, I was like, oh, I don't know if I want to do this the rest of my life,
Mm.
right? I don't know if I want to work
Right.
in social startups. I'm like burnt out and I'm working for other people, and I was an impossible person to manage. God bless all my managers in the past. No, really. The only reason they kept me on is because they needed me because I was so productive.
Right.
But yeah, so I was like, okay, what do I actually want to be when I grow up? And I did a whole analysis for myself, and I realized I wanted to work directly with the beneficiaries of my day-to-day work. I wanted mentorship, and I wanted more control over doing what I thought was right.
Love
So
that.
meaning I didn't want a boss telling me what to do. I
Right.
wanted either to have a boss that let me be subject matter expert and give me autonomy, or be my own boss. And so I was like, okay, I know kind of what I want to do, but in what realm? And so I went to my Google search history, and my Google search history is all, like acupressure points for this, and nat foods to help with asthma, food, et cetera, et cetera.
Right.
And so I was like, okay, there's something here. And at the time, I hadn't realized it. So I had befriended an acupuncturist,
Okay.
because I was living in Medellin, Colombia at the time. And so I wound up befriending an acupuncturist who would invite me into treatments and started mentoring me before I consciously knew that's what I was going to go into. Um, and then I decided on Chinese medicine in particular because, one, the acupuncture really, really helped me in those emotional upheavals. I
Mm.
hadn't started the herbal side yet, but eventually when I was in school, I did, and my psoriasis got significantly better after that, from another flare that I had. And then I was already in it, but I didn't know. Like, it wasn't conscious in my mind that like I was already being mentored in this medicine.
Right.
And then
Right.
one of the reasons why I chose that as opposed to like Ayurveda or other types of like medicines that have a whole systems approach, was because in the United States, especially in California, which is where I was planning on moving, um, acupuncturists are considered primary care providers. So they're taken
Gotcha.
more seriously as a bridge between East and West. And so I eventually decided that I, quit my job, took 6 months off to rest because I was so burnt out. and then went to grad school, and then I started my practice, and I focused my entire practice in autoimmunity and dermatology.
I love it. Yay. And I love I want to be careful what rabbit hole, because I could talk to you for 5 hours, starting up, when nobody wants to hear our conversation about growing up on the East Coast as a
Yeah.
Jewish girl with Jewish tummy.
Yeah.
Or why, even though certain people, are like, I don't believe it. You never cheat with gluten, is exactly what you said. No, why? I would
No, it
never do that to
hurts.
myself. No.
It hurts. And the
Ouch.
more I learn
Yeah.
about celiac, I'm like convinced that I have it.
Yep. Well, yep.
But I can't get diagnosed now because I would have to eat gluten.
Right. Well, and that's how that was what happened to me. Was my son was diagnosed with diagnosed with celiac when he was 12. I went gluten free to support him, middle school. And I remember it was like right before his bar mitzvah. It's like, and back then I actually, thought that it was so important, such an important part of that age to eat junk food. Like,
Yeah.
it's just kind of funny. And then my rheumatologist was like, oh, well, I bet you have celiac. I bet that was your first autoimmune and you just don't know it. And same thing. They were like, well, we'll do a biopsy, but you have to start eating gluten. That was as far as I got. I tried, I failed, and I will never do it again.
I won't even try. I was like, literally, you
No.
look at all of the extra intestinal manifestations of celiac disease.
Yeah.
I even had the dermatitis herpetiformis. Like, I remember it as a kid. I would have these long wheels.
Yeah.
Like these long wheels on my arms and legs. And that's what dermatitis herpetiformis is, right?
Yeah.
So it can show up on the abdomen too, but like it looked exactly like the pictures. And I was like, oh crap. Okay.
Yeah. And my son actually didn't present with any GI issues.
It was all extra intestinal.
Yep. And luckily, we found out, much to the surprise of everybody, because he had been tested, blood tested back then 1,000,000 times, which nobody ever told me didn't mean anything. And he was doing it as a rule out. And they were like, ugh. I remember literally when getting the call from the pediatric GI doctor, it was like 5:30 at night and I had a chicken pot pie in the oven.
Oh no.
And I was like, wait, what do we do? Cute. Anyway. See, we could go in 1,000,000 directions. I want to circle back to, because I do love, there are not enough practitioners focusing on autoimmune and dermatology, and not a lot of true healers focusing on dermatology, right? Nobody's asking why, not enough at, connecting gut health and all the things. I always, nobody has a steroid cream deficiency. Like that's not really what's going on. But I want to dig in a little bit and have you teach us about Chinese medicine, and this approach, because you're a trained functional medicine provider. But I know from chatting and reading, that you really, Chinese medicine is your approach. And yes, you have tools from being a functional medicine provider, but really you come at it from a different perspective.
Yeah. So, it's a great topic. So first I want to address some things. So it's funny because you say healer. I am not a healer.
You're a conduit.
Yeah, it's more like I don't feel like I'm a healer. And I feel like having that perspective makes it much easier to be more scientific, right?
Gotcha.
And also like when I think about it, if anything, whatever I give people is 20% of the solution. The other 80% is them and their genetics and their habits, right? And that's true of any medicine.
Right. But I'm guessing you're not giving them that 20% and sending them out the door.
Oh, no. I definitely support them. Yeah, 100%. We're a support system for sure. But like sometimes, because I've seen people in my profession be like, I'm a healer, but like this person's not getting better. What am I doing wrong? And I'm like, no.
Yeah.
It goes to take a step out and be like, this is their healing journey. I am a helper on that journey.
Yeah.
What more can I do to help them turn a corner?
I
So
love that.
that's the first thing. And it feeds into Chinese medicine. So Chinese medicine is a very sophisticated medical system. It is still practiced in China, in hospitals, and actually, it's their entire training in China and in Japan is dual East Asian medicine with Western medicine.
Gotcha.
And actually, uh, back in the Mao Zedong era, he tried to get rid of Chinese medicine,
Yes.
and he couldn't. So he
Yeah.
wound up just accepting it in this like very public display of drinking herbal medicine, et cetera, et cetera. So he really tried to get rid of it to like modernize, but
Right.
it didn't work. It didn't help because Western medicine on its own wasn't meeting people's needs in China when they were so used to this other sophisticated medical system. But having both is extremely helpful and makes it much more powerful. So so that's like the interesting part about Chinese medicine is that we had a lot of people will have, at least I had this perspective that it was more of like this hippie, like energy medicine. It's actually not. It's a very, very sophisticated system of medicine that has multiple arms. Acupuncture is just one of them. And as I was telling you before, but I'll say now too, acupuncture is what is known the most about Chinese medicine. But the character for acupuncture includes moxibustion, which is a technique where you burn mugwort on and near strategic points in the United States without burning the person, because, we're a litigious society, but in China and Japan and Korea and a lot of places in East Asia, they do burn the skin as a therapeutic
Oh, interesting.
modality. But it's just as important as acupuncture. And for autoimmunity, I find if I had to choose one tool in terms of that particular arm of Chinese medicine, it would be moxibustion instead of needles.
Interesting.
It makes such a difference. So that's one arm of Chinese medicine. Another arm is herbal medicine. Herbal medicine is super sophisticated. It's their own form of pharmacy. And instead of taking, studying and taking an active ingredient and hyperpotentializing it, they keep it in the herb because all of the other elements of the herb help to negotiate it coming into the tissues and into the cells. Right. And that's the interesting part is that it's very it's so scientific, even with the herbal medicine. And now they do a lot of research into why the herbal medicine works. And they've actually tried in the United States and the UK in particular. I have a teacher, Mazen Al-Kafaji. He's the TCM dermatology expert, and he specializes in dermatology, autoimmunity, and allergic disease. And he's been doing this for 40 years. Like he's the go-to expert. And so I trained with him for a year and took the hardest test of my life to pass his like diploma course. But he has been consulted on a lot of these studies that are trying to like figure out what is the one herb that helps with like peanut allergy or eczema, and they can't get it less than 4 herbs in a formula.
Yeah.
Because it doesn't work on its own. It's the synergy between them.
Which makes total sense.
Yeah.
Total sense. So, and back to moxibustion for a minute, because as I confessed to you before we recorded, I had never heard of it. I've done interviews on Chinese medicine before, and nobody's ever mentioned it. Nobody else has it in their bio. And you said it, I just want to circle back.
Yeah.
I'm guessing, when you said like that, if you had to pick one, I'm guessing you don't usually pick one is kind of what I wanted to circle back to.
No, I don't. But if, and it depends on the issue at hand. So, like for rheumatism, 100% moxibustion over herbal medicine. For dermatology,
but what about
100%.
acupuncture? No,
acupuncture is, if you're gonna go for, so I deal with a lot of like joint pain. So particularly autoimmune joint pain. So like PSA, psoriatic arthritis, rheumatoid arthritis, polymyalgia rheumatica, a lot of
All
different
the
autoimmune.
owies. Yeah.
Yes, all the owies. And moxibustion makes a huge difference. And that's the one time I will actually, with consent, burn with moxibustion because it will immediately remove the joint pain. 9 out of 10 times.
Really?
Mm-hmm.
Wow.
And I send them home with stick-on moxa so that they can do it daily.
Oh, cool. So, okay. So then they can continue ongoing treatment themselves.
100%. And that's the whole point. Like my goal in practice is to get somebody to not need me anymore.
Right.
Right?
Yeah, me too. I know it's a terrible business model, but it is what I'm here in
I
the
actually
world to
think it's a
do.
great business
Well,
model
it is.
because then you just help more people.
Right.
And it keeps
Right.
it interesting,
Yeah.
right? Because you get new cases and you're
Oh,
like, oh,
yeah.
okay, this is
Yeah.
interesting. I haven't seen this before. Let me go down the research rabbit hole.
Yeah.
But yeah, so that's moxibustion is extremely powerful because it gets really deep down to the blood level. It works in the same way as needles, where needles will move what's called the chi, which is effectively like the energy within your body. So the nerve pulses, oxygen through the blood, things like that, whatever brings energy
Yeah.
into the system. It's really hard to compare, to really encapsulate chi in a Western mindset, but it's effectively everything that powers your cells and movement and talking. So it's like hormones is chi, nerve impulses is chi, things like that.
I think of it as
So
like life. This is so not, I'm sure, accurate, but in my lay mind is, you know, life force energy is what
huge
like
part of it.
all of that, you need all of those things.
Yeah, exactly. And
I,
so it's what makes you alive.
I want to back up, which is probably the first question I should have asked you, which would be, you know, what is, and this is a broad question, but what is the Chinese medicine approach to autoimmunity? Like, what is going on in the body?
Okay, this is a great, great question. There are 4 leading theories. I did my doctoral thesis on one of them because I found it to be the most relevant to today. So I will go into that one because we would be talking for 7 hours if I went into the other 3. So it's a concept of that's called yin fire. So effectively, yin fire is the displacement of metabolic fire in the body, right? So a yin fire scenario is the displacement of that metabolic fire because we have metabolism that's supposed to work on, you know, feeding these cells so that they do XYZ and feeding these cells so they do XYZ and feeding the immune cells so that the innate and the adaptive immune system are balanced and they're like fighting what's going to hurt you and preserving what's going to like nourish you.
Yeah.
So a yin fire scenario is effectively a displacement of that metabolic process, right? It's like a confusion in that metabolic process. I'm not going to go deep into the Chinese theory where it's like the spleen drops into the kidney. Like it's not that.
We don't need to know that.
Yeah. So the way I like to describe yin fire scenarios or yin fire, so because yin fire itself is good, yin fire is equivalent to metabolic fire. I think of yin fire as the pilot light. And the yin fire scenario that causes autoimmunity to be when oil drips into the pilot light.
I love that. I'm such a visual person.
Yeah.
So I love that.
Yeah. When I teach, so I put together a course on yin fire scenarios for practitioners. And like the image I use is like, it's someone in the kitchen who is, you know, by a stove, normal, happy, smiling, cooking. And then it goes to the next one where they obviously there's been like a grease fire and there's like burnt everywhere and there's soot on their face. And that's kind of what happens in autoimmunity is that you, through injudicious diet, which is a big part of it, through genetics, through like HPA axis dysfunctions, aka really, really high stress, through infectious disease that completely wreaks havoc on the system, oil drips into the pilot light and then wreaks havoc on the system. And so the autoimmune symptoms is the system trying to go back to homeostasis after when there's still oil being dripped into the pilot light.
So are you saying that the autoimmune symptoms are information? Wow. That's amazing.
Yeah.
I love that. And I'm joking because to me, like if that's one thing that listeners, constantly are reminded of, is that their symptoms are there to tell them something's out of balance.
Pain is your body trying to stabilize you.
Love that. Yeah.
That's what it is. Even when we talk about simple back pain, I don't try and just get rid of back pain when it comes into my clinic. I try to understand, what is it protecting? So, for example, there's a lot of people who get autoimmune symptoms who have Ehlers-Danlos syndrome or similar hypermobility syndromes.
Yep.
And almost all of them have neck pain, right? The reason they have neck pain is because the cartilage in their spine is not stable enough to support their spine. So their body holds it with muscle. And that's why they have neck pain. So if you try and aggressively get rid of neck pain in somebody with Ehlers-Danlos syndrome, you will make it worse over time.
Right. Makes sense.
Yeah.
Yeah.
So that's just like an example of showing that, like, it to your point, it's all information.
Right.
And you need to understand what that information is. So something like a biologic is never my first step.
Right.
There are people that do need to go on biologics, and
there's always a time and a place.
Yeah.
And I had a client yesterday, a new client who's currently on a biologic. And I love it. She used the word and we hadn't even gone into it yet, that she's like, as a bridge. She's a young mom, but she's smart and she knows that, no, I don't want to do this for the rest of my life and I shouldn't have to. And when I healed and came off of all my medications, including biologics and DMARDs and you name a category, I was on it. I went through a phase, kind of like how we have processes for grief and things, of where I was like anti-medication because I'd been so over-medicated and told that was the only option and believed it for so long. And I've come full circle now with, like, there is a time and a place, just like when you were talking about the hospitals, right? How they've got their Chinese medicine pharmacy filled with herbs and weird smelly things that do wonderful things, right? But if I need emergency surgery, that's not the answer I'm looking for.
Don't come to me if you break your arm.
Right.
Go to the doctor, right?
Right.
If you have a tumor, get it cut out.
Don't get acupuncture. I mean, get acupuncture,
No,
but also
definitely get acupuncture with it. But, like, if you have a tumor, go get it cut out.
Right.
Right.
And that's I always love to highlight, like, nobody here is here bashing Western. The love of my life is a Western medical physician. Right. And he gets to use that training and knowledge with the functional medicine approach. And it's the best of both worlds.
Yeah.
And so, that's the ultimate, I think, really, of being able to bring it all together when necessary. The goal is, for me, to get to a place where you're consistently healthy enough and understand your body enough, where Western medicine really becomes emergency medicine. It's acute care.
That's what it was. It stemmed from hero medicine.
Yeah.
Right. It stemmed from hero medicine, which was all about these heroic gestures, which does help when you need those heroic gestures. Autoimmunity does not respond to heroic gestures. Dermatology does not respond to heroic gestures.
No.
Right? There are a few cases where I will advise people to do Western in addition to East Asian medicine for dermatology. For example, if you have shingles, go get on valcyclovir and come to me so I can, like, moxa it, and needles. Needles is very, very helpful for shingles.
Right.
Needles and moxa are extremely helpful for shingles. Needles are also very good for hives. It kind of can, like, take it out immediately. Needles are not good for eczema. Needles are not good for psoriasis. Needles on their own. Needles will help the body, calm the nervous system, help, like, slightly move all of the pieces in place so that you can metabolize herbal medicine well, right? So I usually will suggest doing, so my treatment plans are, the shortest treatment plan I have written in the last 3 months is 11 pages, right? They are literally how-to guides for each person to be like, okay, I'm here, I'm at A, I want to get to Z. How do I do that? And how do I push or pivot? How do I know to push or pivot? Right? So I literally, my second appointment with people, they're so overwhelmed by the treatment plan, but they're also so grateful.
Right.
I'm like, I'm not expecting you to do all this at once. That's why we see each other for the next 6 to 8 weeks, every week,
Right.
so that we can help you move the needle, no pun
Right.
intended.
Yeah. Which I love. I remember the first time you told me about your treatment plans, and I
Yeah.
was like, wow. But as somebody who loves a good guide,
Mhm.
I mean, that's amazing. I need to step up my game. That's amazing. Amazing. Well, because here's the thing, you're giving people the understanding of what really the healing path is.
Yeah, and understanding,
So,
because another realm of, well, 2 other realms of East Asian medicine, there's diet, right?
mhm.
And particularly nutrition, and that's when you overeat stuff and undereat stuff. And then there's the lifestyle aspect, right? So
Yeah.
trying, like, mitigating overwork, mitigating stress response, right? Navigating stress. Because I never say managing stress, because you cannot manage stress. The only
Right.
thing you can do is navigate through it,
Yeah.
and, like, and
But
have
having the
grace.
tools to do that in a
Exactly.
healthy way. Yeah.
Exactly. There's a
Yeah.
lot of at-home treatments, right? There's like when we deal with thyroid conditions, I'll always have them gua sha their neck, because it's shown to decrease antibodies in both Hashimoto's and Graves', right? Like it it's just shown to,
Okay,
it
now
helps
tell
to.
me more.
So Korea has done a lot of really great research in this. Um, so, and then I have also seen it in my patients, right? I actually just had a patient. So I have a patient who she has Hashimoto's. She has thyroglobulin antibodies though, not TPO antibodies.
Okay.
So she went undiagnosed forever because they didn't test her thyroglobulin antibody. That's a whole other conversation. And I know
Yeah.
there's been a lot about Hashis, but she was doing neck gua sha. Her thyroglobulin antibodies went from 67 to 16 in a matter of 3 months.
Wow.
She stopped gua shaing, and 9 months later, it was up at, like her antibodies were up at 35.
And what is
Right.
gua shaing?
Gua sha. So you take effectively a soup spoon, like
Mhm.
one of those porcelain soup spoons. That's what I give people. This is your gift. And then you just scrape your neck, both the front and the back of your neck. And so what it's effectively doing,
Blood
it's, yeah, it's allowing for blood
flow.
flow. And so it's like letting loose lymphocytes that are living in the tissue so that the lymphatic system can then take, it's not lymphatic massage at all. Lymphatic is completely different, but it's effectively loosening them so the lymphatic system can get rid of them.
Yeah, okay, just like I'm just
Yeah.
sitting here now. It's very rare for me to be speechless. And I'm like, my mouth is hanging open for anybody listening on audio that can't see the expression on my
Yeah.
face.
And it's hard because so my thyroid mentor is a woman named Heidi Levy out of New York. She's awesome. And she talked about, someone sent her this article, this scientific research article out of Korea about the gua sha for antibodies. And she threw it away because she was like, this is bullshit. Oh, sorry, this is bull.
Oh,
Right?
just say it.
Okay.
Come
I don't
on,
know if
I'm
we
from
can.
Jersey. Yeah.
Okay, good. Yeah, New York. So it's fine. So like this is BS. Like, and so she
Right.
just threw it
Because it
away. She didn't.
seems so hard to believe, which is why
Yeah.
my mouth is hanging open.
She's like, absolutely not. She's a very, very logical person. She's like, absolutely not. I'm out. She has Hashimoto's, but it like kind of stuck in her mind. She's like, I'm going to test it out on myself.
Uh-huh.
So she took her blood test, found out what her antibodies were, did gua sha for a month,
Without
retook
changing
them
anything else,
without
I'm
changing anything
guessing.
else. And then retook her labs, and they had halved. And she was like, okay, maybe there's something to this. And then she kept looking for the research article and she can't find it. So she literally has a bounty out. So if anyone can find this article,
Because it exists.
because it exists, it was like through an email, and then she like, put
Yeah.
it in her spam box and then deleted her
Crazy
spam
bin.
box.
In the crazy
Yeah.
bin. Yeah. Wow.
So, but there are other articles coming out of Korea that show for Hashimoto specifically, doing neck gua sha will decrease TSH and increase free T4.
Wow. That's incredible. And I want to highlight another little piece of that story, which is regarding like your patient that you started with. Somebody just asked me the other day, well, do you say you're in remission? Do you say you don't have rheumatoid arthritis anymore? And I was like, it's all semantics. Like, it's not something I actually think about anymore. It's not a part of my life. However, I am 1,000,000% certain that if I went back to living the way I was living that got me sick in the first place, I would be clinically diagnosable with rheumatoid arthritis again in the future. Like, there's no question. And that example just reminded me of my sweetheart is a much gentler, kinder human than I am. And so when somebody, has been on plan and it's working and, it's like, yay. And then they come back in that scenario of like, they're not on plan and you can see on labs it's not working. He's really great at just highlighting like, well, what you were doing was clearly working. And when you don't do it, it's not working.
Yeah.
So,
that's the beauty of labs. Like I run labs on everyone because I need that baseline and I need them to see progress because I'll see it in the pulse.
My whole thing is how do you feel? But also I'm a geek and I love seeing antibodies correct. I love seeing inflammation markers go down, fill in the blank. The particular patient I was thinking about, was somebody with prostate cancer. I wanted to see his PSA continuing to go back down instead of starting to trend upward again, and so there is this reward of, being able to track and see like, and if I don't work it, it doesn't work.
It also, self-reporting is really hard because you're with yourself 24/7.
Yep.
I had someone come in yesterday who, so he has psoriasis. He came in originally with nail psoriasis, but then he got a really effectively strep throat. And for psoriatic, strep throat is like 1 day. You have 1 day of a burning sore throat. And then because your body is like Th1 cytokine dominant, it just like knocks it out. But then 6 to 8 weeks later, you have a psoriasis flare. And so that's what happened to him is he had this sore throat. He was doing really well. His nail psoriasis was almost completely grown out. And then he came in November with like actual like now psoriatic lesions. He had scalp lesions that had like come down on his forehead. He had body lesions that he never had before, and he was freaking out. And he kept saying, "I've never had this before. I've never had this before. I've never had this before." I keep going deep down there. I was like, actually, I've had this before when I was a teenager, when I was 20, or when I was, and I was like, okay, so you just like, and for him, if it's on his torso and he can cover it, he doesn't think about attention to it. It's when it's in visible areas that it starts freaking him out. But we were able to get him on track. His body lesions went away in about 8 weeks, which is actually pretty fast for psoriasis. But his nails got a little bit worse. And his scalp is actually significantly better. I'm pretty impressed with his scalp. His nails got a little bit worse. So I saw him yesterday and he's like freaking out about his nails. And I'm looking at his scalp and his scalp is clear. It's the clearest I've seen it ever. And his nails are the way they are because he was gardening and they were responsive to the Kubner phenomenon, right? Which is when you, in sites of trauma, you'll get psoriasis. So because he had been working with his hands, his nails got worse. But he had told me like they were almost he's like, oh, they were kind of almost clear. And then I did this, like, what's wrong? What's not working? I'm like, no. It just means from a Chinese medical perspective that you have toxic heat in the blood level that we just need to then work on.
Yeah.
Right? Like it's information.
Right. And I love that. I think it's part of I always tell clients that, one of my biggest roles as a coach is making you look over your shoulder to realize the progress you've made, because we
100%.
don't. I love that you brought up the self-reporting, or like last week, a client was in clinic in person, with her husband. They both had lab reviews, and she's a long, complicated case, fabulous, fabulous lady. And after, she gave her thing, I turned to him and I was like, and what have you noticed? Right? Because we do discount all the time, what's going on in our body, or like you said, if we don't think other people can see it or we're pushing through it, we're not acknowledging and we're not aware.
But it's funny because I talked to this person and because he had eliminated all of the super inflammatory foods and he had snuck all of them back in. And so his nails were completely clear.
Yeah.
And then he's like, oh, something's wrong. Like this isn't working.
I'm broken. Something
I know, but
yeah.
I'm like, no, you reintroduce these foods
cause
and like
effect.
Yeah, and I don't like I'm at the with him I've mentioned going back on Otezla to him because of
Wow.
it's really hard for him to
because if you
integrate the
can't
food.
do the
I told him
had a
that's an
client yesterday saying she was feeling sad because she's like, I just don't think I can eat bread anymore. And I'm like, what kind of bread? Last I had spoken to her, she was gluten-free. Oh, I had a whole wheat bread sandwich the other day, and man, my gut was a wreck. And I was like, yes, you connect your own dots now. Like,
I know, and it's hard. It's hard because I get it. He wants to live the way he wants to live.
Yeah.
And he's had psoriasis since he was a kid. He's had scalp psoriasis since he was a kid.
Right.
And so I that's where like Western medicine does work because it does suppress symptoms if you want to keep living the lifestyle you want to live. And I approached that with him and I was like, listen, like you're doing pretty well now, even with some integration. You have a little bit of nail psoriasis. That's from the Kubner. Let's focus on herbal medicine for you. And then he gets consistent, because he lives pretty far away. So he comes to see me once every 6 to 8 weeks. Okay. And then he gets community acupuncture because he lives about an hour and a half away, closer to him so that it's more accessible.
Right.
Because one of the things about psoriatics is we have a personality type where the way I describe it is we turn our hobbies into obligations. And so we tend to be hyper stressed out people. And acupuncture minimally, even if it's needles in the wrong place, will calm down the nervous system and allow for psoriatics to like not get so overwhelmed.
Interesting. I think that's interesting to hear you say that about psoriatics specifically. Somebody had asked me once, do you see a fair amount of control freaks? And I'm like, every client, I mean, it may look different on the outside, but yeah, every client I've ever had, perfectionism is like, and it took me, I can't tell you how many years to then look in the mirror and be like, if I should look at myself. And so, and these are things that serve us until they don't. I don't know. So, yeah.
No, exactly. And so that's the thing is like, I think one of the reasons why I gravitate towards autoimmunity and dermatology is one, because it's very much, there aren't very many options in Western medicine.
Right.
Period. There's aren't.
No.
I get a lot of people who are at their wits' end. I get a lot of people who are like, I'm coming to you out of sheer desperation. I literally had a patient who would faint with needles, including blood draws. And she had really bad eczema. And she came to me because she's like, I don't know what else to do. So I'm willing to risk fainting to figure this out. And she never fainted on my table, thank God. She fainted in other acupuncture clinics, but like, because I referred her to a community clinic so now we have a community room within my clinic. But before, when we didn't, I would refer her to this like one practitioner in a community clinic nearby who I knew and I studied with, and I like gave her the baby needles. I was like, use only these needles on this particular patient. And she still passed out once. But she's
worth it to her to get better. Yeah.
She made a great recovery. It took her a while because she was a teacher and she kept getting sick. And with eczema, you are Th1 cytokine deficient. So you actually catch colds really easily. And then it triggers your eczema. So it kept being like this, like back and forth
cycle. Yeah.
Yeah. But she eventually, her immunity got better. Her eczema is significantly better. She was dependent on steroid creams for 20 years. And now she uses it once every 4 months when she has like a tiny bit on her heel and she wants to wear sandals.
Right.
She just went through like a whole pregnancy and had a really smooth birth. And
Nice.
I haven't actually talked to her in a couple weeks because she's in, complete
New
postpartum
mama.
mama
Yeah.
mode. But she was like pretty stable throughout her pregnancy. It flared, her eczema flared like twice. And we couldn't use herbal medicine. We just, because with pregnancy, you can't really do, I mean, you can, I just don't know how to.
Right.
So I usually refer
It's
out
not worth, yeah,
that.
that's not, yeah. And I can feel the, like, this is why you do what you do, right? I
100%.
love it. I love it. So here is some people's least favorite part of the podcast. Is my favorite part. I think it's listeners' favorite part too. What is, it could be anything, one step that listeners can take today to start to support their health?
A really good question.
I know it's a tricky one. It's tough.
I think the first step is assessing what they're doing and like making a list of like good, bad, missing. So things they know that are good for them, things they know that are bad for them, and things that they might be missing from their life.
I love that. I love it.
Yeah.
I
think
love how
that's the
you got
first step.
you got like lots of things in that one step too. I knew you were going to, but like masterfully. It's just you did it legally. I love it. That's great because, we have more knowledge and intuition than we realize. And so I love that.
We know
Just
what
assessing.
I tell people this all the time. You know more about your condition than any of your practitioners.
Yep.
So, and what I hate is when my patients aren't taken seriously, not just by Western, by any other practitioner.
Right. Yeah.
Right. I had somebody come in who was so dismissed by his last acupuncturist, who pretty much said his insomnia was because he quote unquote ate like Gwyneth Paltrow. And I was like, that is so mean. Like, no, that's not the only thing. Like, look at his whole, like, he was a therapist. And so he, was taking on
Taking
other
on a
people's
lot of
energies
people's,
and
yep.
like, he wasn't processing them well.
Right.
Right. So I'm like,
Yeah.
there's so much more to it than just like, you are a vegetarian and don't eat enough.
It's never one thing
Never one
anyway.
thing. And
Yeah.
it's never one thing that solves it either.
No, because we're complex whole humans. And
Exactly.
so, yeah, I love that. And I love that it was about a man, because so often we talk about, because it is so common, especially in the autoimmune world, of women being belittled and women not being heard and women getting offered antidepressants because their doctors don't know how to help them or don't understand what's going on with them. And it's happens to Ben too.
No, it does.
So,
It happens to a lot of different people are dismissed, and it sucks because Western medicine is a do we intervene or do we not game. There's no
right.
prevention. There's no,
Right.
except for functional, like there's no real
Right.
prevention. There's no, I've literally had people, I have this one patient, he's so lovely. And it's also he's trans. So it's even more marginalized than women in healthcare.
Sure.
But he has so many different markers for different autoimmune conditions, but none of them lead up to a diagnosis.
Right.
And none of them are high enough for them to intervene.
Yeah.
So they literally just say, you have to live in pain.
Oh.
There's nothing we can do for you.
Well, but the beautiful thing is, instead of him getting stuck in that system like I did for over a decade, taking all of the medications, he had to keep searching and found you.
He did. And
That's
honestly, he was having asthma and he got an inhaler and it wasn't working. And when you look at the rest of him, he has some sort of connective tissue disease. We don't know what it is. It's not MCTD. It's not rheumatoid arthritis.
So here's a question though. Do you need to know what it is in order to help him heal?
No, but here's the thing. I thought of that. I'm like, he has these issues with his muscles and his joints. What if the breathing is intercostal muscles? And so we did acupuncture and herbal medicine for the intercostals, and his breathing got 98% better. And so to the point where he like had me write a letter to his pulmonologist to be like, this is what we saw.
This is what you missed.
Yeah. Well, this is
Yeah.
what we saw. He obviously has these other connective tissue issues. The intercostal muscles are a huge part of that. So
Sure.
like you have to look at the whole person, not
Right.
just the one symptom.
Yeah. And that is this disjointed Western approach, right?
Yeah.
That's why for what I'll call lifestyle illnesses, if you will, even with genetic components, still always lifestyle.
Yeah.
But that's not acute care, and that's not what Western medicine does well.
No.
Period.
Yeah.
Oh, well, I've kept you so long. Before I let you
It's okay.
go, for people that are listening on the go, as I tend to when I'm listening to podcasts, where's the best place to find you?
So my clinic website is Tendervine Health. I have a personal website too, but I don't really update it, and it's mostly for other practitioners. But yeah, so it's Tendervine, TENDERVINE Health. So if you Google us, we're there, and we're based out of Berkeley, California. So we don't really do remote, but if you want to like pay attention, because we try and write blog articles as much as possible, because it's not just me, it's a team. We're a team of practitioners now. So yeah.
And amazing information you're putting out there. So,
Thank
Sydney,
you.
thank you so very much. I appreciate all of the wisdom you shared with us today.
No problem. Thanks, Julie, for having me.
For everyone listening, remember you can get the transcripts and show notes by visiting inspiredliving.show. I hope you had a great time and enjoyed this episode as much as I did. I'll see you next week.
Thank you for listening to Julie Michelson's Inspired Living with Autoimmunity. Did you enjoy this episode? Please like, share, and subscribe wherever you listen to podcasts. If you'd like to get a transcript of this and every other episode, just head on over to inspiredliving.show or click on the link in this episode's description. There, you can also find everything we discussed in this episode, including links and information about our guest. You can even send in your questions to be answered by Julie in a future episode. That's inspiredliving.show. Until next time, this is Julie Michelson's Inspired Living with Autoimmunity podcast, helping you take your power back.